Well, welcome to the show, everybody. I'm your host, Jack Canfield. I have a wonderful guest today. His name is Dr. Alan Lindemann, who has a forthcoming book called Pregnancy Your Way, which will be available soon. He's a doctor that can talk about that. He's delivered over 6,000 babies into the world, and he is here to share with you what he learned in all of his years of practice about how to reduce risk in pregnancy and delivery and how to keep low-risk pregnancies and deliveries low risk. In other words, we'll keep them at the same level. All right. Well, so really excited to have you here. Welcome to the show, Alan.
Well, I'm happy to be here. Thank you.
I love what you're doing. I love your book. So tell us what you're trying to achieve with your book.
Well, we want to introduce to the public, pregnant women in particular, autonomy and the idea of choice and opportunity. And like Steve said yesterday, knowledge is power. So that's what we're trying to do for our consumers, is give them power, give them choice.
Okay. So yeah, a lot of people don't have the information they need, and they don't have a sense that they are in power, that they can be an advocate for themselves or have the advocacy they need to have a birth plan that works and to make it, effective and not dangerous and so forth. What is the inspiration? What inspired you to write this book? Because it's not an easy task to write a book, as you know, but you did it. And so what inspired you to take this on?
Well, of course, I fell in love with obstetrics in my third year of medical school. And that's when I could see very clearly, not only did we have two patients, but and sometimes what's good for one wasn't good for the other one, but there's usually a good way out of it. So there is potential. And that's different from any other area of medicine. You're patching some mess or, trying to fix something that's broken. So here in obstetrics, we get to start with a blank slate.
And so that's what you like about it. It's starting with the blank slate. I love
it. Exactly. A lot of opportunity.
A lot of opportunity. Well, just talk for a minute about some of the, why is this such a challenge these days? That so many people don't know what to do, or they live in so much fear, or we hear about so many challenges and problems that appear. Is it just lack of information? What's going on out there?
It's a very good question. I think there are lots of things happening. Certainly, COVID hasn't helped anybody communicate at all. They've separated, husbands and wives and children. I think we have made some, I shouldn't say mistakes, but take, for example, high blood pressure. Mm-hmm. We have the habit of, I would find years ago, I'd send my patients to the hospital if they had high blood pressure, and the nurses would check their blood pressure 10 times until they got a low blood pressure and send them home. I think that's a dangerous topic, a dangerous idea, because it's easy to work with that. In other words, if you have a patient who is working 3 12-hour days, that's much worse than having 5 6-hour days. And then, of course, eventually, when you get to be 35 weeks, maybe you're not going to be working at all anywhere. And patients should know how to check their blood pressure at home. They should know what's dangerous for them. And also, there's a lot of moms who have trouble eating when they're pregnant. Mm. A lot of times you'll see they'll get into the car and they'll open the window so they can vomit out the window. But it really has a lot to do with motion sickness. So, eat your breakfast, sit down for 20 minutes or so, and then get into the car and drive. In 6,000 patients, I have no patients who have had to get hyperalimentation or total parenteral nutrition. So this is something I've learned from my patients, and it really works.
Well, anyone who's delivered 6,000 babies successfully has earned the right to talk about it. So here you have this book. There are a lot of books for expectant mothers out there. What do you think makes your book stand out from the others written on this topic?
Well, I really want to stress choice. I want to stress autonomy. I want to stress opportunity. Um, the other thing is, most of what is in my book, I've learned from my patients. And they have given me very valuable information. For example, how to eat in the morning so you don't have morning sickness.
Well, give me an example of that. How should one eat in the morning to avoid morning sickness?
I would say the first thing is to have something by the bed so you don't have to get up to eat. Something simple like an apple, maybe some cheese, something that has to do with some carbohydrate, but also some protein and some fat. And then lie in bed for another 10 minutes or so, and then get up and eat a bigger breakfast, say an egg or cheese or something with some protein in it, not just carbohydrates. Because when you have, say for you have an example, a breakfast of, my wife calls them cardboard Krispies, cornflakes, So what happens then, your blood sugar goes way up, and then the insulin goes way up, and then your blood sugar goes way down, and you feel terrible. You want to vomit, and sometimes, and then you can't eat after that. So the other thing to remember is don't shower before you eat.
Why is that?
I think it is a combination of low blood sugar and low blood pressure. So eat first, get your blood pressure up, get your legs working right, get your shower, then sit down and just take your time about getting ready. And I think that has helped a lot of patients. Again, I've learned that from my patients.
Wow. So there's a lot of practical experience here that people can benefit from, because I'd never heard of any of that, and I've had 3 boys, and morning sickness was part of my wife's experience. So I get it. It's cool. I love your book. There's a lot of practical wisdom in there, and I really appreciate you for taking the time to put it into print and get it out there to people. Where can people learn about your book? Where can they find about you if they want to connect with you? I know you're available as a consultant and so forth. Where do they go?
Well, we can go to lindemannmd.com, and we can go to rural Doc Allen, and that's ALAN.com.
Very good. Very good. Well, I just wish you the best of luck with this book. You're going to save a lot of people unnecessary discomfort and pain and possibly even heartache. So keep up the good work. Thanks for joining us today.
Thank you very much, Jack. Glad to be here.
I appreciate it. And for all of you watching at home, if you are someone who's about to be pregnant, you are pregnant, you have a daughter or a niece or a daughter-in-law who's about to be pregnant. And I just literally in my life in the last month, we've had 3 births among my friends and my daughter-in-law. And so this is valuable information that needs to get out there. So please share this with everybody. And thanks again for watching. And also tune in again next week. We'll have another guest who can help bring wisdom and insights and valuable information that can help you live a happier, healthier, and more fulfilling life. And until then, take good care of yourself.